Welcome to Native America Calling. I'm Andy Murphy. As the largest outbreak of cyclospora infections continues across the country, the public's confidence in the safety of the food we eat is faltering. The state of Michigan alone counts more than 10,000 cases. Tribal public health officials are among those reaching out to consumers with information about the parasitic infection and how to avoid it. They're also reassuring the public that such serious intestinal diseases are relatively rare. We'll also get updates on how public health officials are responding to the recent food safety threat. That's right after the news.
This is National Native News. I'm Jill Freitas. Efforts to encourage more Native Americans to vote are underway in more than a dozen states this year. Chuck Quirmbach reports on how things are going in Wisconsin ahead of the state primary contest on August 11th.
The nonpartisan group Wisconsin Native Vote is about a decade old and is now up to 4 organizers around the state. They've already been doing outreach at powwows and a variety of other community events. Spokesperson and organizer Ann Egan-Wakaw is a member of the Menominee tribe. She says a key message is that voting is a way to make sure Native voices are heard.
We tell people to vote for the 7th generation. That's what really resonates with people because our ancestors worked to make sure Mother Earth was clean, healthy for us, and it's our job to do that for the next 7 generations. But also it's working to make sure we retain our sovereignty.
Egan-Wakaw says tribal sovereignty is an especially powerful theme for the Menominee, which only won back full tribal status in the early 1970s after much activism and debate with state and federal elected officials. Still, this is not a presidential election year, and Wisconsin only has high-profile races for governor, the House of Representatives, and state legislature. Statewide voter turnout is expected to be down from 2024. But Egan-Wakaw says there are some big problems, new and ongoing, likely to motivate tribal members to vote.
Like we had listening sessions and people came to talk to us about issues that are important to them, like the data centers, the opioid problem that we have on our reservations.
Egan-Wakaw says she does encounter people who are cynical about voting and politicians, but she says she asks them, do they really want to do nothing at election time? For National Native News, I'm Chuck Quirmbach.
The Eklutna tribe's powwow and potlatch happens only once every 2 years, but when it does, it draws hundreds and hundreds of people to the village of Eklutna, a few miles north of Anchorage. The weekend of dancing, drumming, and feasting kicked off Saturday at the tribe's powwow grounds. Aaron Leggett, the president of the native village of Eklutna, says that what makes him most proud is that no one leaves hungry because the tribe feeds everyone.
We'll have moose, various types of moose stew and roast and fish, salmon. It's just sort of our way of really being open and good community partners.
Many also bring dishes to share. Leggett says the tribe had plenty to celebrate this year, including the groundbreaking for its long-awaited gathering hall, funded in part by the success of its new casino. But more than anything, Leggett says the gathering is a chance for Anchorage, Chugiak, and Eagle River to get to know their neighbors in the village of Eklutna.
There are certainly people that wouldn't necessarily, when they think of Eklutna, maybe they would think of the cemetery and the church, but don't really have any other sense of it. The powwow potlatch really was our way of increasing awareness to the community and building that up.
The theme for this year's event was Restoring Our River 97 years later. It highlighted the tribe's efforts to restore the natural flow of the Eklutna River and its wild salmon runs. This story was provided by KMBA's Rhonda McBride. On this day in 1795, the Treaty of Greenville was signed, ending the Northwest Indian War. The agreement between the United States and several tribal nations ceded much of the present-day Ohio to the United States, marking a major turning point in federal tribal relations and westward expansion. I'm Jill Freitas.
National Native News is produced by Koahnic Broadcast Corporation with funding by the Corporation for Public Broadcasting.
Tribal Development Partners, helping tribes build toward their goals through 105L leasing and essential facility development, empowering sovereignty, strengthening community. More at tribaldevpartners.com, proud supporters of this show.
Hear that? Tribal college faculty do so much, one can't say it all here. Nothing but respect. Visit mostthoroughdjobdescription.com. The American Indian College Fund supports this program.
Native Voice One, the Native American Radio Network.
Welcome to Native America Calling. I'm Andy Murphy, sitting in for Sean Spruce. Cyclospora infections continue to rise across the country in what is called the worst outbreak of the parasitic disease ever recorded. Officials report 2 cyclospora-related deaths in Michigan. Hundreds of others have been hospitalized, and thousands of people are seriously ill right now. Public health officials blame contaminated lettuce for the majority of the current outbreak, but the severity of it has people worried about the reliability of public food safety measures. Tribal public health officials are among those tasked with monitoring infections among their citizens. It is particularly hard to trace the source of cyclospora infections because of how long it takes for symptoms to surface. Officials believe the actual number is much higher than the official count. Today we'll talk with health experts about the realities of cyclosporiasis, other food-borne illnesses, and food safety at home and across the food chain. You can join our discussion by calling 1-800-996-2848. That's also 1-800-99-NATIVES. Do you have questions about food safety? Again, that's 1-800-99-NATIVE. Joining us now from Anchorage, Alaska, is Dr. Matthew Clark. He's the Chief Medical Officer for the Alaska Area Native Health Service, Acting Deputy Chief Medical Officer for the IHS, the Indian Health Service, and the Chair of the IHS National Pharmacy and Therapeutics Committee. Welcome back to Native America Calling, Dr. Clark.
Good morning. Thank you, Ms. Murphy. Appreciate the opportunity to join you again.
Mm-hmm. And joining us from Helena, Montana is Will Seeley. He's the Tribal Enterprise Manager for the Indigenous Food and Agriculture Initiative. Welcome to Native America Calling, Will.
Hey, thanks for having me.
And joining us from Maui in Hawaii is Harley Moore Wilson. She's the Director of Agriculture for the Flower Hill Institute and a citizen of the Osage Nation. Welcome back to Native America Calling, Harley.
Thanks so much for having me. I'm excited to be here.
Yeah. I want to start with Dr. Clark here. Dr. Clark, what is cyclosporiasis?
So appreciate the question. Cyclosporiasis is a disease caused by a parasite called Cyclospora. It's a gastrointestinal disease that primarily causes diarrheal illness in those that are affected.
Okay. And Cyclospora is a parasite. How does it work in the gut and affect a person's health?
So Cyclospora is usually acquired either through a food source or a water source. And once ingested, it can cause damage to the small intestine, which results in the diarrhea. Persons who are infected can then pass the what are called oocysts, essentially eggs, in their poop, in their fecal material, and that can lead to contamination of food and water sources that can result in additional infections among other persons. It's important to note that there's no person-to-person spread, however, directly.
Okay. And is this current, this has been called the worst outbreak of a parasitic disease ever. How do you imagine that happened? And why now?
So cyclospora has been around for many decades now. I believe the first human outbreaks were first recorded back in the 90s, and probably before that, before we recognized it. But you're right, this appears to be the worst cyclospora outbreak in the United States. Cyclospora is typically present. It's endemic in tropical and subtropical locations, so not so much in the United States. However, infections in the United States can result from contaminated food sources that originate in tropical and subtropical locations. I think one of the issues is the issue of food safety and the way that food is acquired, these days. And I think that with the recent multi-state outbreak that was tied to iceberg lettuce in Mexico, that's just one example of how the parasite can be imported into the United States.
Okay. And how does the IHS contribute to finding the source of an outbreak? I mean, does IHS keep track of the number of cases in its system?
Sure. So IHS physicians and public health officials are actively involved in identifying potential outbreaks of food-borne illness and gastrointestinal disease. We maintain a high index of suspicion, especially during this time of year, which is the typical season for cyclospora, May through August, because of the heat. So recognizing gastrointestinal illness as a potential result of outbreaks of food-borne illness is important, and tracing potential sources is important so that we can reduce infections in travel communities.
Okay. And I want to go back to cyclosporiasis. How long does it take for a person to show symptoms that they do have it?
So typically the so-called incubation period, which is the time between when you are exposed to the parasite and the time when you develop symptoms, can range anywhere from a couple of days to a couple of weeks.
Okay. And when should someone see a doctor? I know you mentioned it causes some diarrhea, it causes some illness, but how bad does it have to get for someone to go to a doctor?
Yeah, it's a good question. So fortunately for most people who have a healthy immune system, cyclosporiasis is not dangerous, but unpleasant. And because of the potential for outbreaks linked to a common source, I think anyone who's having significant gastrointestinal symptoms, things like frequent watery diarrhea, associated symptoms of dehydration, sometimes flu-like illness that can accompany it, within a couple of days, it would probably be wise to seek medical care, both to determine the cause, but also for potential symptomatic relief. I think it's also important for those that are at the extremes of age, the very young and the very old, and those with impaired immune systems, if they have gastrointestinal symptoms that are significant, to seek healthcare access sooner rather than later.
Okay. And then what does treatment look like?
So for most people with a healthy immune system, cyclosporiasis is a self-limited condition, meaning that over a period of days to weeks, occasionally months, the symptoms will resolve on their own without treatment. That said, there are treatments available that can block the reproduction of the parasite, specifically combination antibiotics. Common examples are Bactrim and Septra. They're sulfa-based antibiotics. There are alternatives available for those that are allergic to sulfa antibiotics. And for those that are at the extremes of age or with impaired immune systems, treatment is likely indicated if they're having significant symptoms.
Okay. And the main source is lettuce from Taylor Farms. That's what we've been hearing in the media, and has been identified as a major source. What other foods should we be sort of taking a second look at right now?
So the multi-state outbreak that's been linked to Taylor Farms related to iceberg lettuce from Mexico is one likely source for cyclospora outbreak in the United States, but there are likely others as well. Cyclospora is commonly associated with consuming contaminated food, including lettuce, herbs like cilantro and basil, berries like raspberries and blackberries. Those would be common examples of potentially infected food sources.
Okay. And where can people stay informed about what foods are likely suspects and maybe what brands?
So there are a variety of places online that you can seek information about current recalls. So, for instance, the U.S. Department of Agriculture maintains a recalls and public health alerts service online, as does the FDA. And then I often direct people as well to foodsafety.gov, which includes not only recall information, but information about how best to prevent foodborne illness.
All right. Thanks for that, Dr. Clark. We're going to be back with Dr. Clark here in a bit, as well as some other guests here to help us talk about food safety and food safety in the food chain. You can join our conversation with your comments and questions about food safety. We're at 1-800-996-2848, 1-800-99-NATIVE.
Native language advocates are pushing back against a recent New Yorker review that suggests it's okay to let some languages die. The Endangered Languages Project and other organizations dedicated to reviving languages say giving up is not an option. We'll hear from Native language experts on why the effort to keep languages going is worth it. That's on the next Native America Calling.
Grand Canyon Conservancy fosters visitor engagement with the landscape through learning, discovery, and stewardship. The Grand Canyon Conservancy Field Institute provides immersive and educational adventures designed in partnership with Grand Canyon National Park, including day hikes for the family, once-in-a-lifetime backpacking trips, and art classes with expert instructors. More at grandcanyon.org. Grand Canyon Conservancy supports this show.
Thank you for listening to Native America Calling. I'm Andy Murphy, and we're talking about cyclospora and other foodborne illnesses. You're welcome to join our conversation with your questions, like when to seek treatment, how to take care of someone who's sick, or how best to handle food in the home. Join our conversation by calling 1-800-996-2848. If you're a food entrepreneur, what food safety rules do you have to follow? That's also 1-800-99-NATIVE. I want to go back to our guest, Dr. Matthew Clark. He's the Chief Medical Officer for the Alaska Area Native Health Service and Acting Deputy Chief Medical Officer for the Indian Health Service. Dr. Clark, what other foodborne illnesses should folks also be wary of this time of year?
Sure. So foodborne illness is actually relatively common, especially during the summertime. In fact, the total number of likely cases of foodborne illness exceeds 45 million per year on average. But there are a variety of potential sources. These include not only parasites like Cyclospora, but bacteria like Salmonella, Campylobacter, toxins produced by Staph aureus, which is a bacteria that can sometimes infect food, as well as viruses like norovirus, which folks commonly think of in terms of exposure on things like cruise ships and other gatherings of large gatherings of people.
All right. All right. Well, I want to bring in our other guest here. We have Will Seeley. Will Seeley is joining us from Helena, Montana. He's the Tribal Enterprise Manager for the Indigenous Food and Agriculture Initiative. Will, how does something like Cyclospora, an outbreak of Cyclospora, affect the whole food chain for, say, tribal agriculture operations?
Yeah, Andy, I think there's a few different ways. I mean, one is on the producer side of things, if it is tied back to one product like this has been to iceberg lettuce, it really can affect the sales of iceberg lettuce. So not only does it have to be tied to, say, just Taylor Farms, it does have an effect on the whole iceberg lettuce market and can be detrimental if, especially on that larger scale, as you look at, selling to large retailers like Walmart and grocery stores and things like that. On the flip side, though, it can be helpful for local producers to just as the warnings come out for these larger scale distribution systems, then people start to look at their local producers a little bit more. So it's also good for the smaller producers that are selling at farmers markets and things like that to actually be ready for a potential influx of customers. So, being on the lookout for that as well on the other side.
Okay. And help us understand just how big some of these food chains are. I mean, we have an outbreak of Cyclospora from one source. We hear about Taylor Farms. Like, how does Cyclospora, get it, from one source go to a bunch of different states and counties across the nation?
Yeah, so I mean, like if you think about a large company like Taylor Farms, they're gonna have farms in multiple locations, multiple different sizes, and sometimes across different countries. So, and then thinking about that and how that flows into the different and makes its way to the consumer. A lot of times it can go to somewhere that's like an aggregator, and especially if it's further processed where it's chopped up for those salad kits or things like that, then it can make it a little bit harder to track down exactly where the contamination like occurred, and it makes it a little more complicated. And then the other thing too for tracking wise is produce has a limited shelf life. So a lot of times consumers are buying this at the store and then eating it within a couple of days or so. And it's hard, once reports start coming in that people are getting sick, to actually be able to pull some of this from the shelf can be difficult just with its limited shelf life as well. So it makes produce, have its own unique challenges when it comes to a recall type of situation.
Okay. Do you know of any tribal businesses or food operations that are being affected right now specifically?
I don't know of any directly. I would assume, whether it's a tribally run grocery store or retailer, probably having to have keeping an eye on, where they're sourcing their produce from and all of that too, on the retail side of things. As far as producers directly, I don't know of anything exactly. I also think about the FDIPR warehouses and just figuring out, where those are being sourced from as that comes through um, uh, through the DoD program, fresh program, then having to track through all those multiple different providers.
Okay. For Dipper, that's the commodity foods program.
Yeah, yeah. Sorry about that. Yeah.
Yeah, yeah. What kind of food safety laws do producers have to abide by?
There's quite a few. If we're talking about produce specifically, primarily going to be focused on the produce safety rule, which is a kind of a part of the Food Safety Modernization Act that was signed into effect under the Obama administration in 2011, I believe. The produce safety rule was really put under FDA's, the Food and Drug Administration's management, and this is really kind of their first time working with on farm, like food safety on the farm. So over the past, I don't know how many years that's been now, 15 years. There's been a lot of education efforts to try and educate producers, produce growers on what they have to abide by now, because this really was the first rule focused on farm produce, specifically safe food safety. So there's been a lot of things for the producers to educate themselves on and make sure that they're abiding by. If they aren't exempt from the produce safety rule, there are some exemption statuses that come with it to where you don't have to directly follow exactly what's in there. But although you may not have to follow that, we do like to work with folks. These food safety practices are good even if you're just serving your local community.
Yeah, and talk a little bit more about that. How you work with tribal producers, and some of the smaller producers and entrepreneurs.
Yeah, so as a part of the produce safety rule, there is a requirement in there that a manager of each farm is supposed to have taken a training that meets the qualifications laid out by the FDA. Currently, there's only one training that meets that was put together by the Produce Safety Alliance at Cornell University. So us at the Indigenous Food and Agriculture Initiative have spent a lot of time going out and providing this training to tribal producers over the past 8 or 9 years through a cooperative agreement that we have with the Food and Drug Administration. And that's been really great. During a lot of these trainings, we are able to get folks certified and meet that requirement of the produce safety rule. But a lot of the farms that we've worked with really would be exempt from that produce safety rule. But the real drive for the producers to actually come and attend this, 8 hour long training and get that certificate is because they're providing food directly to their community, and they want to make sure that they're doing their part to keep their community safe. Whether this produce is going into the schools or the casino food systems or directly through a farmer's market, there's been a real investment from tribal producers, even if they're exempt, to make sure they're doing what they can to keep folks safe that they're providing food for.
Okay, and they would be exempt because they're not large enough, or?
Yeah, there's a few different considerations there, but generally what we see is it's you have to have done, I think, $25,000 worth of produce revenue over the past 3 years, and that's adjusted for inflation. So I'm not sure where that mark is at right now. But if you're under that amount, then you would be exempt from the produce safety rule. Um, so we do see a lot of farms, whether they're just getting started or they're a smaller community garden, or it's all donated food, that kind of provides that exemption from the federal law there. Um, Although a lot of the training is applicable whether you're small scale to very large.
Yeah. Do tribes have their own food safety laws?
Yeah, we find a lot more investment here lately in tribal governments developing their own agriculture and food codes to actually manage food safety within their jurisdictions. At the Indigenous Food and Agriculture Initiative, we've developed a model tribal food and agriculture code that's available for free for tribes that are looking into that. It kind of covers everything from food safety to honey production to standing up a tribal Department of Agriculture. The That would be linked on our website at indigenousfoodandag.org. And you can find that model tribal food and agriculture code. And it's really intended to be uh, uh, kind of a plug and play type of thing where you have the framework and you can customize that to what your tribe needs, for bolstering kind of your tribe's management of those different systems. And we're here to help navigate that too. If folks are interested and want support, feel free to reach out on that.
Okay. All right. And what challenges do some, especially smaller producers, have in adhering to some of these food safety laws?
Yeah, a lot of it, I mean, a lot of the rule was developed with these larger producers in mind, and sometimes it's kind of difficult to break that down to a smaller scale. Whether that be your water distribution systems, the tracking of your produce as it leaves the farm. We try to kind of keep that in mind as we're working with the smaller producers. Water's a big one, especially if you live in a place that's limited on water availability, because having that water that's uh, safe and of adequate sanitary quality that you need to even wash your hands can be difficult for in some areas. So, there's some considerations there, as well as the monitoring of your food safety uh, operations, like what you have going on, even down to water testing. Sometimes that can be difficult when it comes to if you're very remote and you want to test your water, then it can be difficult to get that to a proper lab and get the results, in time to actually take action on some of that stuff. But not only to mention, sometimes the cost can be prohibitive. So a lot of it's really working with folks to be creative on what you're able to do to actually reduce the risk on your farm. Nobody will ever hit it perfectly, but you're doing what you can to actually uh, reduce uh, uh, reduce the highest and more probable risk that you might have.
All right. I'm going to go over to Harley Moore Wilson. She's the Director of Agriculture for the Flower Hill Institute. Harley, some foodborne contaminants on fresh produce like lettuce and fruit, you might not want to hit them with hot water and heat. What do you do then when you have fresh produce like cilantro and lettuce?
Yeah, so thinking about some of those food safety tips that a grower would get from the produce safety training that Will was talking about, making sure that you clean your hands, and making sure that you understand how to wash your hands. So thinking about at least 20 seconds of washing your hands with warm, soapy water, and then using disposable paper towel to dry your hands before and after handling food is one way. Another way is making sure that your countertops or any food surface is clean, and then sanitizing after the countertops are clean and sanitizing with the food grade sanitizer. And you can't sanitize a dirty surface, so you have to make sure that you are doing that in those steps. So understanding that cleaning those with hot soapy water would work, and then sanitizing with that food safe sanitizer is a couple of ways. You don't have to even if you're washing your fruits and vegetables like cilantro under a colder water, that's still better. Make sure that it's a running water versus a pooled water or a sink full of water, because at that point, if you have that sink full of water, you could have a lot of cross-contamination. Once that water has been contaminated, it spreads really quickly to any of the non-contaminated produce as well.
Okay. And we're going to go to a break in just a bit, but are there any products or chemicals that we should stay away from when we're especially like rinsing and cleaning produce?
Yeah, just making sure that you read the label. If the cleaner, the sanitizer says it is food safe, then that is food safe. But if it doesn't specifically describe a food safe on the label of that specific cleaner or sanitizer that you're using, then I would not use it on a direct surface that your food would come into contact with.
Okay. All right. And what are some tips you can share about, just constantly keeping your kitchen clean? And what are some things that maybe you can tell yourself about, why this is important?
Okay. Yeah, for sure. Making sure to keep your cooking space clean. It doesn't even have to be a kitchen. It could be, an outside grill area, or a lot of people are having outside kitchens as well, or thinking about in a tribal nation, we're cooking outside around a fire. And so making sure that you are replacing your sponges and your dishcloths regularly. If you're cutting meat or fruits and vegetables, you want to have a designated cutting board, designated knives.
Okay.
I know that sounds kind of silly, but making sure that you have those separate cutting boards as well.
Okay. We'll be back after this break.
Addiction, anxiety, and depression can be rooted in ancestral emotional baggage passed down through generations. That cycle can be broken with an energy healing experience available to all at resvolution.com. Discover Healing supports this show.
Kaufman & Associates is a Native-owned and led consulting firm supporting Native communities with culturally grounded solutions to shape Indigenous futures. More at kaufmaninc.com, KAUFFMANINC.com.
We're glad you're listening to Native America Calling today. I'm Andy Murphy, and we're talking about foodborne illness and food safety today. Have you had an illness caused by Cyclospora, E. coli, or Salmonella? How did that change your eating habits or the way you work with food? There's still time to join our discussion if you give us a call at 1-800-996-2848. That's 1-800-99-NATIVE. Harley Moore Wilson is joining us today. She specializes in food safety. And Harley, just before the break, you were talking about, having a designated, designated knives and maybe cutting boards for different food. Can you continue with that?
Yeah, of course. So understanding that raw meat would be a very high contamination of potential bacteria. And so if you are utilizing a cutting board for raw meat and the same cutting board for fruits and vegetables, more than likely you'll get cross-contamination of those bacteria. And so making sure that you have designated cutting boards for raw meat, poultry, and seafood, and then another for fruits, vegetables, such as ready-to-eat foods. So basically you have your foods that you need to cook versus your ready-to-eat foods, having those separate spaces. And a lot of times you'll see in a kitchen that they'll have separate designated areas for those different activities as well. Something else to help kind of keep your kitchen clean is making sure that you're keeping your pests out. So having dry food storage along with cleaning up your crumbs, avoid leaving out dirty dishes, and making sure to take out your trash frequently. Those are all really good tips and tricks to keep your kitchen clean.
Okay. And what about storage? What kind of tips can you help us out with storing different types of food? Where at, and what temperatures are good to know?
Yeah, of course. So understanding that you want to keep your cold storage at below 40 degrees Fahrenheit or 4 degrees Celsius. So that would be your refrigerator. And so that would be for fruits, vegetables. If you are then handling raw meat, if that meat is frozen and you are needing to be able to cook it, you would want to put it in the refrigerator. Don't leave that out on the counter. Your freezer should be below 0 degrees Fahrenheit, negative 18 degrees Celsius. If you have perishable foods, you want to make sure that those are also in that refrigerator within 2 hours, unless the temperature is above 90 degrees, and then that would be you're wanting to put those perishable foods in a refrigerator within an hour.
Okay. And what about leftovers? Is there a number of times you can warm up leftovers?
You can warm up leftovers anywhere in between a minimum of about a minute, I would say, but sometimes it would be more than a minute, depending on what that product is.
Oh, okay. And what about how many times can you warm it up? Say if you have a really big giant pot of stew and you keep taking from that pot. Like how many times can you warm something up?
Yeah, I would say that typically you would only want to warm up the product one time before you are really starting to get into potential microbes growing on that product, and reheating it is not very safe.
Okay. And how about I'm thinking of a celebration or a community event where we have people bringing different dishes, and it's kind of sitting there for an hour or so throughout the event. I mean, how long can foods like maybe a fruit salad, how long can those stay out like on the table at these events?
Yeah. If it is below 90 degrees outside, then the food should be good up to 2 hours. But if it is above 90 degrees Fahrenheit outside, then definitely within an hour, you wouldn't want to eat those foods after an hour that they've been setting out.
Yikes. An event at 90 degrees outside is hard to imagine, but I want to go back to Dr. Clark here. Dr. Clark, there's these days, there's some misleading and wrong information that comes out about food-borne illnesses. We've definitely maybe read some memes or so about cyclospora. Has there been a lot of that this time around, and what's your role at the IHS for correcting misinformation?
Sure. So I think there's always the potential for misinformation. Making sure that you utilize a trusted resource is important. Many of those are available online. IHS has been working over the last couple of months to put out public health messaging in our tribal communities related to cyclospora, and both how to recognize it, have it diagnosed and treated, but also how to prevent it as well.
Okay. And we just talked to Harley about some food safety tips. Dr. Clark, are there any food safety tips that you think we should always keep in mind when we're in the kitchen?
So she basically nailed it. What she was going through there is the 4 important food safety tips, which are to clean, separate, cook, and chill, which are available on the U.S. Department of Agriculture website. And I do think the question that you brought up earlier about large gatherings, this time of year, it's not unusual for folks to be getting together for a barbecue or what have you, but making sure, especially during the summertime, that we're following those guidelines that she laid out is especially important as we try to reduce the risk of foodborne illness.
Okay. All right. And overall, Dr. Clark, do you think folks should just be paying more attention to food safety?
Yeah, I think food safety has always been an important issue, especially in the context of preparing meals for your family or for a larger group. As I mentioned, it's relatively common foodborne illness. And just being aware of those basic guidelines about how to reduce risk that she discussed is really important. Just making it a part of your day-to-day routine when it comes to food preparation.
Okay. And when a person does get sick, and say they get sick from cyclospora, and they're laid up in bed and they have to stay close to the bathroom, how should maybe their partner or how should their roommate help take care of them?
Sure. So first of all, cyclospora, as I mentioned earlier, is not generally spread from person to person. It's through water or contaminated food. So unlike other foodborne illnesses, such as, say, norovirus, for instance, the risk is very low to a caregiver. For folks who are at the extremes of age, very young, very old, those with impaired immune systems, I think seeking out medical care early would be wise. But generally speaking, supportive care is going to be the mainstay of treatment. So making sure that folks are properly hydrated is one of the most important things. For cyclospora infection, there are treatments available for those that are at risk or to reduce the duration of symptoms. So seeking medical care is also wise.
Okay. And what sort of liquids are best in that time?
Always a fan of water. You can't go wrong with water. Electrolyte repletion, such as with some of the sport drinks like Gatorade or Powerade, sometimes can be additionally helpful, although keeping in mind that it has a lot of sugar in it. So really the mainstay is making sure that you stay hydrated with water.
Okay. And what about foods?
So, in terms of food intake for folks who have gastrointestinal illness, it's going to be dependent on what they can tolerate. So, in some instances, when there's associated nausea and vomiting, or gas and bloating, maybe sticking with simpler foods, things like clear liquids, broth or jello, or those types of things, and then advancing the diet to more routine foods as those symptoms subside.
Okay. I want to go back to our guest, Will Seeley. He's the Tribal Enterprise Manager for the Indigenous Food and Agriculture Initiative. Will, we just had a person call in, Ed in Bethel, Alaska, who was on KYUK. He called in, but he left us a question. Does the presidential administration favor an increase or decrease in imports from different countries? Maybe you can help us out with that one, Will?
I'm not, I'd be a little hesitant to answer that. I think from what I've seen, it kind of depends on where that's coming from and exactly what the situation is. Sorry, I wish I had more to say on that one.
Okay. Do you think we're better off and maybe safer if we're going to local farms and producers?
I think generally, I mean, when you think about the large scale, like a lot of these outbreaks, especially with produce over the last few years, has been a lot of times tied to these larger companies that have multiple farms. And, when you think about a contamination event like irrigating with water that's been contaminated on those larger farms, the event's gonna be wider, and the reach of their product is wider too. So, it's going across multiple states and things like that. When you're on that smaller scale, I'm not gonna say that the risk isn't there, but I think the effect on people is going to be not nearly as broad as it would be in a commercial, large commercial scale agriculture type of situation. That's not to say that it's, your local foods are perfectly safe. There can still be issues there, but the reach is going to be a lot less. And tracing that back to where it originated is actually going to be the supply chain is shorter, so it's easier to trace that back to where something may have gone wrong if that does happen.
Okay. All right. I want to go back to Dr. Clark here. What are some tips to improve overall gut health? Does the IHS recommend, for preventative care with gut-borne illnesses?
So apart from the food safety topics that we've discussed over the last hour, gut health is dependent on maintaining variety in your diet to support your gut microbiome. So, moderation in all things. So making sure that you're not overdoing it in terms of fried foods and fatty foods, and ensuring that you're getting an appropriate amount of produce and whole grains can support your general gut health.
Okay. Do pre-existing conditions like diabetes and high blood pressure, does that affect how folks are impacted by foodborne illness like cyclosporiasis?
So to the extent that folks may have an impaired immune system, so diabetes would be one example if it's not under control, then certainly your risk related to foodborne illness is increased. So, for instance, people with uncontrolled diabetes might be more likely to have dehydration, and when faced with a significant diarrheal illness, that can contribute further to that dehydration, especially the summer, as we're dealing with a lot of heat-related issues. So just maintaining hydration status in the setting of a diarrheal illness and a coexisting illness like diabetes. Some people with hypertension may be on medications that impact their hydration status, although if they're in close consultation with their medical provider, that shouldn't be too big of an issue. But I always recommend for folks who have chronic disease, if they're suffering from significant symptoms from gastrointestinal illness, that they seek medical care in a timely way.
All right. Well, that is all the time we have for our conversation today. I'd like to say thank you to our guests. We just heard from Dr. Matthew Clark, Will Seeley, and Harley Moore Wilson. Join us tomorrow for a conversation about the limits of saving a native language. I'm Andy Murphy.
tribal colleges and universities support their students in countless ways. They say I believe and offer help before it's asked.
Hear that?
Fully, give grace.
That's everything tribal college faculty do for their students on Fast Forward. Because if one tried to say it in real time, they'd be here all day. They teach, guide, comfort, and connect. And for that, the community is grateful. Learn more at mostthoroughdjobdescription.com. The American Indian College Fund supports this program.
They give extensions, share progress, share laughter, create calm, and allow reflection. They inspire hope, share wisdom, guide gently, validate healing.
Trickster Cultural Center hosts the 12th Annual National Gathering of American Indian Veterans to honor veterans and military personnel of all cultures, eras, and branches in a native way. Trickster Cultural Center's National Gathering of American Indian Veterans is open to the public at no charge Saturday, August 22nd in Schaumburg, Illinois. More at tricksterculturalcenter.org/national-gathering-2026. Trickster Cultural Center supports this show.
Native America Calling is produced in the Annenberg National Native Voice Studios in Albuquerque, New Mexico by Koahnic Broadcast Corporation, a Native nonprofit media organization. Funding is provided by the Corporation for Public Broadcasting with support from the Public Radio Satellite Service. Music is by Brent Michael Davids. Native Voice One, the Native American Radio Network.